Today my topic of lecture is classification of malocclusion. These are the contents in which we will cover the definition, malocclusion intra-arch, angle system of classification, drawbacks of angles classification, Dowie's modification, Siemens classification, and the last one is the ACKERMAN-PROFITT classification system. So what is the definition? What is malocclusion? Malocclusion is a condition that reflects an expression of normal biological variability in the way the maxilla and the mandible teeth occludes according to Bishara. So this is the first classification system, that is the intra-arch malocclusion. Intra-arch malocclusion means when the malocclusion is there in a single arch, whether it is in the maxillary arch or in the mandibular arch. Like first is the distal inclination or distal tipping, like we can see in this figure. Normal inclination says that the central incisor and all the teeth crown are mesially inclined rather than its root. But if it is opposing, like the crown is distally tipping in against its root, then it is called as distal inclination. Similarly, the mesial tipping, if the crown is more mesially inclined as compared to its root. And the lingual inclination, if the crown is more lingually placed in compared to its root, then it is called as lingual inclination. Next is a buccal inclination. Similarly, if the crown is more buccally placed as compared to its root, mesial placement means complete the teeth is placed mesially, then it is called as mesial placement. And distal placement means the tooth, crown and the root completely placed distally, then it is called as distal displacement. Next is the infraversion. Similarly, if the tooth is not in the occlusion, means as compared to its neighboring teeth, it is infra-occluded, then it is called as infraversion. Supraversion, when as compared to its neighboring teeth, it is supra-erupted, then it is called as supraversion. Then the rotation, as we all know what is rotation, and the transposition. Transposition means the position of the teeth is completely changed. For example, if the central incisor is placed in between the premolar, then it is called as transposition. Next is the intra-arch malocclusion. Intra-arch malocclusion means the malocclusion which is present in between both the arches, like in the maxilla as well as in the mandible. Like this situation is the normal occlusion. In this the maxilla and mandible is ahead of the cranium, maxilla and mandible is behind the cranium. In this the maxilla is ahead than that of the mandible, and this is the skeletal class 2, this is the skeletal class 3. It is in the sagittal plane. Then next is in the vertical plane. This is the intra-arch malocclusion in vertical plane, means it is the normal overjet which is 1 to 2 mm and overbite that is 2 to 3 mm. But if the lower incisor is placed more, it is in the deep bite relation, means when there is overjet is more than that of normal, then it is called as vertical plane malocclusion in deep bite relation, and it is the open bite when there is no overjet. Similarly, the transverse plane malocclusion means when the maxilla is narrow than that of the mandible, it creates the cross bite. When mandible is narrow, then it creates the scissor bite. These are the transverse. Next is the angle system of classification. Angles ने 3 system दिए classification के, that is the angles class 1, class 2 and class 3. This is angle class 1 malocclusion. Angle says when the molars are in class 1 relation but still there is malocclusion, whether there is spacing or crowding or the cross bite anterior or posterior, then it is called as class 1 malocclusion. Then is the angles class 2 malocclusion. Angle says if the molar are in the class 2 molar relationship but still there is malocclusion, then it is called as angles class 2 malocclusion. These are of 2 types, angles class 2 div 1 and div 2. Div 1 means there is increased overjet, narrow of the maxillary arches, lingual tipping of the lower incisor, and patient is having the persistent tongue thrusting or the thumb sucking habit. Then is the angles class 2 div 2 malocclusion. Div 2 malocclusion means in this the lingually inclined upper central incisor and labially tipped upper lateral incisor overlapping the central incisor, like this. The central incisors are retroclined but still the lateral incisors are proclined, or the canine are proclined. Then it is called as class 2 div 2 malocclusion. Then class 2 subdivision. Subdivision means on the one side there is class 1 molar relationship but the another side there is class 2 molar relationship, then it is called as class 2 subdivision. On the side where the class 1 molar relationship exists, that is called as subdivision on that side, whether it is right or left. Next is the class 3 malocclusion. When the molars are in the class 3 relation, means the mesiobuccal cusp of the upper first molar falls in between the interdental area of the first and second molar. But along with this, the malocclusion is there, like the anterior crossbite is there or S2S bite is there, then it is called as class 3 malocclusion. It is again of two type. It is the class 3, true class 3 and the pseudo class 3. True class 3 means the lower incisor tends to be lingually inclined. And in this the normal overjet is there and an edge to edge incisor relationship or anterior crossbite is there and narrow upper arch is there. And the pseudo class 3 means forward movement of the mandible during the jaw closure. It is called as postural or habitual class 3 malocclusion. It can be because of the presence of the occlusal prematurity, in case of the premature loss of the deciduous posterior, or in case where a child is having the enlarged adenoid. Then again class 3 is there are of 3 type here. Type 1, type 2 and type 3. Type 1 means the upper and the lower dental arches when viewed separately are in the normal alignment. See, maxillary and mandible are in the normal alignment. But when the arches are made to occlude, the patient shows an edge to edge relationship. Then it is called as type 1. Type 2 means the mandibular incisors are crowded here and it is lingually tip. And type 3 when there is true crossbite is there. Then it is called as type 3 class 3 malocclusion. Similarly, class 1 malocclusion having 5 type, it is called as device modification. It is type 1, type 2, type 3, type 4, type 5. Type 1 means class 1 malocclusion with bunched or crowded anterior teeth. Here the crowding is there with class 1 molar relationship. Type 2 means class 1 molar relationship but proclined anteriors. Then is the type 3. Type 3 means class 1 molar relationship with anterior crossbite. Type 4 in this the posterior crossbite, and type 5 in this the permanent molar has been drifted mesially due to the extraction of the second deciduous molar. Here we can see here the mesially drifted molar is there. So these are the angle classification system. Then is the Siemens classification system. Siemens system of classification made use of 3 anthropometric plane. These are the FH plane, orbital plane and the mid-sagittal plane. This is the FH plane, the line passing through the orbit to the tragus of the ear. This plane is called as FH plane. In these two classification system is there. First is the attraction and the abstraction. Attraction means when the dental arch or the part of it is closer than that of the normal to the Frankfurt horizontal plane. मतलब ये जो arch है वो ऊपर की तरफ shift हो जाएगी. Then there is the infra-occlusion or it will create the open bite. Second is the abstraction, means the complete dental arch or a part of it is farther away from the FH plane, then it is called as abstraction. In this the deep bite can be seen. Orbital plane. Orbital plane, this is the orbital plane, the plane which is passing through the mid of the eyes. It is called as orbital plane. Here the two malocclusion is there, protraction and retraction. Protraction means dental arch or the part of it is farther from the orbital plane. Orbital plane से दूर है means proclination है, and retraction means it is closer to the orbital plane means retraction है. And third is the mid-sagittal plane, means the plane which is passing through the mid of the face. Then it is called as mid-sagittal plane. In this the distraction and contraction, two malocclusions are there. Distraction means the complete arch is away from the mid-sagittal plane, it will create the scissor bite. And the contraction means when the complete arch or the part of it is closer to that of the mid-sagittal plane, means it is create the cross bite. Then last is the ACKERMAN-PROFITT classification system. ACKERMAN and Profit in 1960 proposed a diagrammatic classification of malocclusion to overcome the limitations of angle classification. लाइक उसकी लिमिटेशन थी एंगल्स की, उसने सिर्फ डेंटेशन को कंसीडर किया था बट पूरे स्केलेटल सिस्टम को कंसीडर नहीं किया. तो इसके लिए एक्करमैन एंड प्रॉफिट ने 1960 में क्लासिफिकेशन सिस्टम दिया जिसमें इसने 3 सर्कल्स बनाए दैट एनवेलप टू ईच अदर, इन विच फर्स्ट ऑफ ऑल इट सेज अबाउट द आउटर सर्कल्स शोज द इंट्रा आर्च अलाइनमेंट, वेदर इट इज आइडियल, क्राउडिंग और स्पेसिंग. The second circle shows the profile, whether patient is having the convex profile, concave profile, straight profile, or patient is having the anterior divergent or posterior divergent, like in the case of skeletal class 3 or class 2 malocclusion. And the third, in which the three circles are there. First circle shows the transverse deviation in the buccal or in the palatal side, it will create the scissor bite or cross bite. Sagittal deviation in the anterior posterior direction, it creates the skeletal class 1, class 2 div 1, class 2 div 2, as well as the class 3 malocclusion, whether it is skeletal or dental. And third one, in the vertical deviation means arches are away from each other. It will create the open bite in anterior, in posterior, deep bite, collapsed bite, it may be skeletal or dental. And the last, when these circles are enveloped to each other, like transverse and sagittal deviation envelop to each other to make the transverse sagittal malocclusion. Transverse and vertical deviation envelop each other and make the vertico-transverse malocclusion. Similarly, sagittal and the vertical deviation envelop to each other to make the saggito-vertical. And when all the three circles envelop to each other, they make the transverse, saggito and vertical malocclusion. Thank you so much.